Hello, hello, good evening, everyone. Welcome back to the show. Welcome, welcome. Wow. It has been a great day, great Monday for me. Hopefully you had a great weekend and you had a great start for your week today on this Monday. This is Dr. Dwain Woode. If you're new to the channel, that's Woode with an E, and the E stands for endocrinology. Here, I help to educate, I help to encourage, and I help to empower you to take charge of your health, avoid complications, and live a healthy, fulfilling life. Tonight, we've got a wonderful show for you. It is Black History Month. It is Heart Awareness Month, and we're going to be talking about diabetes and the heart. So Heart Disease 101 for diabetics. That's our topic for tonight, and we'll get into that. If you're also new to the channel, go ahead and put new in the comments so that we can welcome you to our neighborhood, welcome you to our tribe, welcome you to our group. And if you have a question as we go through the night, go ahead and put a Q in front of that question so that we'll be able to find that question in the chat. If you know someone who has diabetes, put yes in the comment. If you know someone who has heart disease, put yes in the comment. That's our question for you tonight as we get into the evening. Also, go ahead and if you have not already done so, go ahead and send this link to your family, to your friends, invite them on over so that they can get and hear and participate in some of this wonderful information that we're going to have tonight. Okay, so take a moment and do that. If you're here and you've not already done so, give us a thumbs up, right? And like us, so that really helps us as we grow this community. Let's see who is out there. And I saw Maria. I saw Maria saying hello to everyone. Hello. Ooh, nice music. Thank you. And once again, guys, our music is powered by Epidemic Sound. Epidemic Sound. We really love the music that they have. And Maria said, I think somewhere she said, I could be a DJ in the evening. Hey, I've got a little mixer software here, Maria. So you may get some of that stuff that I've been doing. Let's see. Lauren is hey. Hello, Lauren. How are you? Says hello, Maria and Dr. Woode. And then I think I saw Anthony. Hey, Anthony. How are you doing, man? Good to see you. And Maria, of course, is saying hello to Lauren. So glad to see you again. And Anthony, Anthony is answering our question. We'll come back to those here in a minute. It says, hi, Anthony. Welcome. So tonight we are talking about heart disease, and we are talking about diabetes. And as we get into this discussion, it really is, or these are really two of the biggest things that we see in our country. In fact, the number one killer of men and women in the country is heart disease. Right? That's right. It's the number one killer of men and women in the country. And diabetes is becoming a pandemic, right? I've said before, we've not used that word pandemic yet, but it's coming. It's coming, guys. And one of the most common causes of heart disease is diabetes. So the number one killer, one of the most common causes is diabetes. And so there is this natural connection between the two, diabetes and heart disease. And tonight we're going to talk a little bit about heart disease. We're going to talk about how diabetes fits into that and some things that we can do, right? Because ultimately that's what we want to be able to do. How do we go about improving our lives, right? Avoiding complications. Remember that? Avoiding complications and taking charge of our health, living a healthy, fulfilling life. Yep. So we're going to get there in just a minute. And we see some other folks jumping in. So once again, guys, if you are new to the area, go ahead and put new in the comments so we can welcome you. Let's see. I'm going to pronounce, so Evie, right? If you can give me the phonetic pronunciation of that first name. So hello, Dr. Woode. How are you? Good to see you. Welcome to our area. Glad that you are here. As Maria is saying, Yvonne, my love, thank you for taking time to join us. So let me pull that up. Hold on a second. Let's see if I can get that on the screen. There you go. And then, of course, we've got Anthony that is just greeting everyone. So, Anthony, thank you. So, guys, once again, if you've not already done so, go ahead and drop a line, grab people who are out there and say, hey, come on over and join us as we talk about this very, very important topic. All right, so why don't we go ahead and let's get started. Yeah, let's do that. So heart disease. And as I talk, you may think of some things, and go ahead and drop those in the comments as we talk. So let's talk about the heart, right? In order to talk about heart disease and what it is, let's talk about the heart. So the heart is a pump, right? It sits in the chest to the left of the center, and it's responsible for pumping blood throughout the body. And the reason that the blood is important is that in the blood, there are nutrients, there's oxygen, which is the main thing. So it's bringing oxygen to your tissues, and it's removing toxins and carbon dioxide from your tissues so that your body can function, right? So that's the main function. It also brings other nutrients, and we're not going to talk about those things tonight, but the body is dependent on this heart, this pump, if you will, circulating your blood. So it's bringing oxygen to the tissues, to your toe, to your muscles, to your hair, to your eyes, and it's taking toxins away. And your heart, believe it or not, and I want you to think about this. Your heart pumps. Your heart pumps for your entire life. Right? So it is moving, right, the entire time that you're alive. And one of the problems that we can run into, right, because you think of this pump and it has these tubes that are coming to it, bringing oxygen or bringing blood from your tissues that it needs to detoxify, and then bringing air, right, through the lungs into the blood and sending it out to the rest of the body. So that's the function, right? So there is this pump that has different parts in it. There are these tubes, right? So arteries and veins that are running away from it. And the heart is pumping, right? So the heart is pumping. And in order to pump, remember, that's a muscle, right? So the heart is a muscle, just like your muscles in your arms and your muscles in your legs, right? The heart is a muscle and it's continually pumping. And it also needs blood, right, from the body in order to function, right? So it's giving blood to the body and it's also getting blood from the body. So all of those things, if you can imagine, can become problematic. So either the muscles don't work well, or the heart doesn't pump properly, right? Or the vessels that are bringing oxygen to the heart somehow become clogged. Right? So those are all different things that can happen within the heart. And so those really are the different types of heart disease, right? So those are the different types of heart disease. Either you can be born with a problem or a problem develops. The most common thing that happens, right? And this is what causes us the problem. The most common thing that happens is that the vessels of the heart become blocked. For some reason, right, and we'll get into that here in a minute, for some reason, those vessels that are supposed to be bringing blood to the heart itself, they can become clogged. And when that happens, then the heart has what we call a heart attack, right? So heart attack. So a heart attack really is blood not being able to get to the heart itself because one of the vessels becomes blocked. And when that happens, a person has a heart attack. Now, diabetes fits in there in a very interesting way. Because remember, the blood sugars that are in the body, they are used to power the cells, right? So they're like, it's like plugging a battery in when you get some carbs, right? When you eat food, that food gets converted to energy, and that energy powers your cells. It's powering the heart, it's powering the muscles, it's powering every cell in your body, right? But if you have too much of this energy, then it can cause a problem. It basically clogs the system. And so the sugar itself can become poisonous to parts of the body. And a part of the body that it becomes poisonous to is the vessels. Those vessels, remember we talked about the vessels? Right, those are the vessels that take blood that has oxygen that's going to the heart. And so because those vessels become damaged, the body's pretty smart. I love my body, right? Because the body's job is to keep us alive. I always say that. That's its function. And so the body does everything it possibly can do to try to keep us alive. So it notices that there is some damage in one of those tubes that's bringing blood. And so the body tries to fix it. And how does it fix it? It's almost like finding, you come home one day and somebody has been digging up your lawn. Well, what do? You go over, well, you stop them from digging up your lawn. You go over and you begin filling it in, right? Because you are trying to, right, fix it. And that's exactly what the body does. It finds a spot in the vessel that's been damaged, and it starts to put cells to try to fix that area. And you can imagine if you have a tube, and inside the tube, right, you're putting layers of cells, what begins to happen? That's right, the tube gets smaller and smaller and smaller and smaller. And what did we say a heart attack was? That's right, a heart attack is when the vessels that are supposed to bring blood to the heart get blocked. And one of the ways that they can get blocked is because of the inflammatory process that happens in diabetes because of the inflammation that occurs because of the damage of the high blood sugar. Not only that, but the high blood sugar also damages nerves. And the heart has nerves that go to it. And so those nerves don't control the heart properly, and the heart begins to beat in abnormal ways. So multiple things can go wrong because of diabetes. Now, here's the ultimate thing. So inflammation because of the high blood sugar causes damage. The damage causes the heart to try to fix it. When it tries to fix it, the vessels become narrowed. The narrowing vessels causes a heart attack. Because there's heart attack, the muscles that are supposed to be pumping become damaged. When they can't pump properly, you get heart failure, right? First one. In heart failure, because it's kind of not pumping properly, now it goes into an abnormal rhythm. You guys may have heard of things like, atrial fibrillation, right? Or flutter, or some of those other arrhythmias. Those happen sometimes because their vessels are blocked or because you have heart failure. And when you get that, because the heart is not pumping properly, now you can have sudden death, right? So ultimately, diabetes, because it causes damage, can lead to heart failure, can lead to arrhythmias, and can lead to death because the vessels are damaged and the heart doesn't work properly. Okay, so that's kind of a small thumbnail of how this all works. And that is why, guys, we are so concerned about when we have diabetes, because it is one of the leading causes of heart disease. In fact, if someone has diabetes, it's considered the equivalent of having had a heart attack. Yeah, you heard me, right? It's a coronary equivalent is what we say. And so it can cause so many different problems. And so one of the things that we are going to talk about here in a little bit is okay, what do we do? Now we have that. How do we evaluate it? What does that mean? And what do we do about it? All right, let's see who is out there. Let's take a break and let's see. Marie is still there. She said, oops, her. Natalie, hello, brother, from the same mother. Happy belated birthday. Hey, man, that's right. So, guys, my sister Natalie is on, and we actually have the same birth date, 2 years apart. And then our cousin, who is older than Natalie, has the same birthday on the same day as us. So we just celebrated our birthday on the 5th, which is this past Saturday. So Natalie, happy birthday again. So Maria says, yes, belated birthday, Dr. Woode. She says, hi, Natalie. Natalie, hey, love. We got a question here already. So I am going to actually star that question, and we'll come back to that. What's up, Tyler, man? How are you? Tyler says, you are the man. I love that. That's why I like you, man, because you always pump me up. And okay, here's another question. We are going to hold on to that one. And Maria's saying, Tyler, welcome back. Awesome. Yeah, Tyler's my man. All right. Okay, so that's the idea behind the heart disease, and that's the idea behind what happens in diabetes, and what causes diabetes to then cause someone to develop heart disease. Okay? All right. So once again, we can have all those defects. Now, here are some interesting numbers, right? So we said the leading cause of death in the United States is diabetes. That's 659,000 in the United States, right? That's 1 in every 4 deaths, right, that occurs in the year is due to diabetes. 1 person dies every 36 seconds. Let me pause for that one. So 1 person dies every 36 seconds. And there's a cost of $363 billion. That's billion with a B, right? I would love to get some of that. Give me 10%. Give me 1% of that, right? Right? That's billion with a B. So coronary heart disease, right, is the most common type of the heart diseases. When we went through those, you can have vessel problems, you can have muscle problems, you can be born with it, you can have valvular problems, but coronary artery disease, that is the narrowing that we described, is the most common type. And 18.2 million adults ages 20 and older have coronary artery disease. 1 in 5 deaths from coronary artery disease is for people who are less than 65. Okay. So what are the risk factors for coronary artery disease? Right. That's the narrowing of the vessel. Now, we said that diabetes certainly is one. Right. That's a big one. And also there is high cholesterol. Right. Because cholesterol, after all, if that is high, then that can also have plaque buildup within the vessels, right? Smoking is another one. High blood pressure, poor nutrition, right? And I'm going to get a question here. Hopefully I'll get a question here in a little while about nutrition from one of our viewers. I don't think I see her in there yet, but she's coming on. So poor nutrition, physical inactivity, right? So sedentary lifestyle can lead to heart disease. And then, of course, type 2 diabetes and obesity, being overweight. So all those can predispose. Now, let's kind of run through a couple of those, right? So with high blood pressure, the reason that high blood pressure can cause damage is because you can think of the pressure within the vessel like water inside of a hose, right? Water inside of a hose. And, if you kind of squeeze the hose, the water's on, and you're squeezing the hose, and there's more pressure that's popping out, right? So the water's going faster. Well, if you take that water and take your finger off the hose, and you point the hose to your arm, and let the water hit your arm, right? You can feel it, but it's okay. Now take your finger, squeeze the hose, and now point the hose with that water shooting out to your arm. What does it feel like? Yeah, it stings, doesn't it? Right? So the pressure inside the vessel, that's what the vessel is feeling. That's that tube that's bringing the blood to your heart and from your heart. Yeah, that's what it's feeling, right? That high pressure. And so it's hitting the wall. That pressure is hitting the wall, and that can cause little nicks in the wall, damage in the wall. And whenever there's damage in the body, what does the body try to do? That's right. The body tries to fix it because that's its job. It's trying to keep you alive. And when it tries to fix it, that's where the problem runs in. That's where we run into the problem. So high cholesterol, right? Those cholesterol globs can also glob onto the wall, right? The high cholesterol itself can cause inflammation or inflammatory process, just like diabetes, like we talked about. And now the body tries to fix that, right? So all of those things can cause issues. And then, of course, poor nutrition, right, is an overriding thing, right? So if we're not eating well, right, and we're eating high fatty foods, we're eating high sodium, and that's causing high blood pressure, and it goes on, and obesity, right? And now we have insulin resistance, we have poor blood sugar control or poor glycemic control, like we talk about. And that also now compounds. Now, you can see if someone has multiple of those, which typically is the case with people who have diabetes. They'll be overweight, they'll have high blood pressure, they'll have high cholesterol, they'll have diabetes or high blood sugars, and they're sedentary. And so all of those now compound what we're seeing with the heart disease. Okay. And then one of the big ones, and let's say that, so smoking, right? Smoking makes all of this worse. So one of the big things, when I was in medical school, the guy who taught us anatomy walked into the room, and in his first lecture, he said, hey, everything I'm about to tell you guys, if you get people to stop smoking, all of this decreases. What? Right? So if you can get people to stop smoking, all the stuff we're about to learn goes down. That was his push to us. All right. So diabetes, right? We talked about the inflammation and how that affects it. Well, people who have diabetes are twice as likely to have heart disease compared to people who don't have diabetes. Yeah. Now, you can imagine that we're already paying, and we're going to go to money for a minute. We're paying lots of money to manage diabetes. And then now we have the complications of heart disease. And that becomes a huge issue. Okay. So how do we diagnose someone with heart disease? We diagnose someone with heart disease by symptoms. We diagnose them with symptoms. And then there are some other tests that we will do. And so the typical symptom that someone will have is the crushing substernal, so sternum, crushing substernal pain. And it's described as having an elephant sitting on your chest. Crushing substernal pain, it feels like an elephant is sitting on your chest. It may be associated with pain in the arm or numbness in the arm, and typically the left arm, with sweating, feeling dizzy, feeling palpitations, arrhythmias, right? So feeling like the heart is fluttering. It can also have nausea, some vomiting. So those are the typical symptoms that you see. Now, with diabetes, particularly diabetes that is longer standing and diabetes that is uncontrolled, sometimes those diabetics don't have the same symptoms because their body doesn't feel all those things. So they can have silent heart attacks, right? So because they have damage to the nerves, they don't feel the fact that that elephant is sitting on their chest. They don't feel that the arm is in pain, right? They don't get the same symptoms. And also women can have non-classical heart symptoms, right? So instead of having pain in the chest on the left side, they can have pain in the chest on the right side. They could have pain in the back between the shoulders. They can have pain around the neck, right? So all of those things are symptoms that you can have with diabetes. All right. Okay, so let's pause here for a minute, guys, and let me do some station identification. If you have not already done so, right, please head on over to our social media platforms. LinkedIn, we love it there. We're starting to build a good following. TikTok, we put those out, and we'll tell you the time here in a minute. On Mondays here, of course, at 7 o'clock is our live show. Twitter, and then buy me a coffee if you would like to support our channel and what we're doing here in terms of building. Go ahead and like us on those platforms, subscribe to us, give us a thumbs up, whatever the platform requires, right? So that we know that you're out there, that you are following. Send it, share it with your family and friends. Tell them to come on over. We've got some good information as we build and as we grow. And then, of course, our lineup, Monday nights at 7 here on this channel is our live. We've got Friday with our TikTok that comes out. And then every day we have our Twitter that puts out informational, educational, encouraging, right? Encouraging information for you. Awesome. So you guys may have noticed that I am sporting, right, my Oakwood University hoodie, right? Oakwood University is where I went to school. It used to be called Oakwood back in the day, Oakwood College. It is now university. I'm very proud to be a graduate of Oakwood University. As we celebrate our Black History Month, I am proud to be a product of an HBCU. That's right, Oakwood. All right. So next week, what I want you guys to do is I want you to, while we're doing our show, I'm not going to be able to see you, but you can put it in the chat, right? I want you to go ahead and wear, right, if you have, or pick up one, wherever you went to school, right? I want you to rep your school, right? Rep your school. I'm wearing my Oakwood shirt again next week. So I'm putting it on. I'm wearing it next week. So like I said, I went to Oakwood University. So glad to be a part of that. And this is a good spot for us to talk about this guy. You may not know who he is, but this is a very important fella. This is Daniel Hale Williams, and he was the very first person to successfully do a heart surgery. So he was born. His father was a barber. He was born in 1858, and at the age of 20. Completed his secondary school up in Wisconsin. He did an apprenticeship and was always wanting to challenge the status quo. And so he worked with the Surgeon General of the state and rose and always continued learning and watching. And in 1893, was when he did the first successful heart surgery. I am an endocrinologist. I am a physician. I'm an African-American physician, and I'm proud to be standing on the backs and learning from all those who came before me, to give me the opportunity to do what I do. Right? Because without them, I would not be talking to you. We would not have this community me being a part of it. And so I'm so excited that that I was able to do that because of men like this. All right. So that's our Black History Month. I'm so excited that we're celebrating this entire month as Black History. All right. So let's see who else is out there. Let's see. So Maria's saying happy belated birthday to Natalie. Of course, Tyler Murdoch, well, welcome back. Awesome. All right. So with diabetes, the complications that we just talked about in terms of heart disease, right? So heart disease, the big one really is the heart attack and the death, right? So those are huge consequences. With diabetes, of course, we've talked before and we will talk in the future about the complications of diabetes. And we know those, right? So retinopathy, so problems with the eyes, nephropathy, problems with the kidneys, and neuropathy, problems with the feet. But now, right, we also have this development of heart disease with diabetes. And so what do we do? What do we do about our diabetes? And we've talked about those symptoms. And the question is, where do we go? So yeah, there's this big problem. Yes, it's causing heart disease. And how do we fix it? Well, I want to talk to you about the ABCs of the management of diabetes as it relates to heart disease. ABCs. A is for A1C. A1C. So getting your A1C within the target range. And the target range for the management of diabetes is below 7, right? In our office, we tell people to shoot for 6.5, right? So below 7, 6.5 is what we want to do as we are trying to treat our diabetes. That's the A, because the better control we have, All right, remember, it is the high blood sugar that causes the damage. So the better control that we have for our diabetes, the better off we are, right? So A stands for A1C. B stands for blood pressure, right? We just talked about the fact that high blood pressure can cause damage to the walls of the vessels. And if we have damage, then that can cause the inflammation, the plaque buildup, and ultimately a heart attack. So managing blood pressure. And this comes in lots of different ways, right? Some of it can be related to the foods that we're eating, high salty foods. It can be related to our weight, right? So weight loss. It can be related to things like obstructive sleep apnea, right? Which is one that we don't talk a lot about, right? That can cause problems with blood pressure. All right. So taking charge of blood pressure, getting that under control is a way of working within your diabetes to help to prevent heart disease, all right? Coronary artery disease. That's A1C, B, blood pressure, and C, cholesterol. So managing cholesterol, making sure your cholesterol is within the target ranges. All right. Those bad cholesterol molecules can cause damage. They are the ones that are significantly problematic when it comes to heart disease and for diabetes. So talking to your physician and making sure that you are doing everything you possibly can do to get your cholesterol under control. Those are huge things that you can do. So the ABC, A for A1C, B for blood pressure, and C for cholesterol. Okay, and there are all sorts of other things, guys, that are doable, right, in terms of managing blood pressure, in terms of managing our cholesterol, in terms of managing our diabetes. And we talk about a lot of these. We've talked about them. We will come and we will continue to say to people, hey, you got to get good rest, right? Because if you get rest, we decrease stress. Or you manage stress easier. I shouldn't say decrease stress, right? You can manage your stress easier. Manage your stress, right? Whether that is meditation or some other form of stress management. Making sure that you are exercising as much as possible. Watching those carbs, right? Dealing with depression. If you're in pain, finding someone to help you with the pain. So all of those are things that we can do to help with our A1C, so diabetes, our B, which is our blood pressure, and C, which is our cholesterol. Awesome. Love it. And then ultimately, we have got to talk about this pandemic. We've got to talk about this pandemic because if we can prevent people, what did I say? If we can prevent people from becoming diabetics, then this goes away, right? If we can prevent them from becoming diabetics, well, at least it takes diabetes as away as one of the main causes of heart disease, right? So doing everything that we can in that arena also helps us with our heart disease. All right. So let's go back here and let's see what we have. So Yvonne said, recently I got a 5.3. Woohoo! Yvonne, congratulations. Let me see where's my music? There you go, Yvonne. Oh my hats off to you. Very good. So for diabetes, right? We talk about the A1C, and so an A1C of 6.5 or higher is considered diabetes. All right. So pre-diabetes, of course, 5.7 to 6.4, and then below that is considered a normal A1C. So very good for you, Yvonne. Woohoo! So Maria, ABCs of diabetes. That's right. ABCs of diabetes. That's A1C, blood pressure, and cholesterol. A1C get in the range which is below 7. The better controlled, the better off we are. Correct. Love that. So Maria's just, and then of course, blood pressure can cause damage to walls of the blood vessels. Manage blood pressure. Stop using salt. Well, not necessarily stop using salt, but certainly decrease the salt. And then cholesterol, talk to your physician to get your cholesterol under control. And then, yes, congratulations to you, Yvonne. I love it. All right. So let's go back here and let's see if we can find some of these questions. Give me just a second, guys. All right, so okay, let's go back and let's see. I think I started a couple. Okay, so she says, what? This is from Eve. I don't know if you guys are hearing an echo, but I am. It says, what is your take on laminine study or reconstructing and repairing of the body? Okay, so let me answer this by answering a general question. So proteins are what the body uses as building blocks. So when we eat food, the body takes those proteins, we take the amino acid, and the amino acids can be used and incorporated into different parts of the body. And so anytime we can provide the body with a good source, and notice I say good source of protein. So people who are trying to lose weight, there's this big fad now of using protein shakes. People who are bodybuilding, right? That's always been one of the things that they did. They do protein shakes before, they may do protein shakes after. And then, of course, we are now starting to see a lot of people using protein shakes in the management of their diabetes because they're trying to get the calories, they're trying to get the protein buildup, if you will, without getting the carbs, okay? So anytime we can give good sources of protein, then that's great. And laminine, which is an egg protein, has been used and shown to help with people who have problems with muscles, to help bulk up, right? And I think, once again, if it's a good source of protein, then it certainly cannot hurt. Okay, let me answer it that way. But always, as I say, check with your treating physician. Okay? All right. And then I think this is just a follow-up question. Is laminine good for our body to repair our cells? And once again, with that idea of good source of protein, all right, and wherever you get your laminine, you want to make sure that you are checking the source, where are they getting it, and so forth. Okay? Good questions. I love that. Let's see. So let's go ahead and let's grab some questions here. Yeah. What is my risk for heart disease? So what is my risk for heart disease? So the risk factors for heart disease comes in a lot of different forms, but they also are similar to what we see when we talk about diabetes. So if we take diabetes out of it for a minute, because that's what we're talking about. So high cholesterol, high blood pressure, sedentary lifestyle, obesity, being overweight, and then of course adding diabetes to that. Some non-modifiable risk factors, being male, right, puts you at a higher risk. The older we get, so the higher risk we are. Having a family history also will put us at risk for heart disease. So those are some of the non-modifiable ones, because you can't really change the fact that you're male, right? Genetically, you can't do that. You can't change the family that you were born into. You can't change your age, and if you can, right, make sure that you remember that I'm part of your community, right? So when you find the water that keeps your age down, find me, please, because I need some. All right. But that's a couple of things that you cannot change. Those are called non-modifiable. Okay. Non-modifiable. All right. Let's grab another question. What are the treatment options to reduce risk for heart disease? Okay. And this one, what are the risk factors? All right, how can you do that? So this one is one that goes back really to the risk factors, right? So we talk about the non-modifiable ones, right? So age, gender, family history, and so forth. But we can certainly modify our diabetes. We can certainly modify our blood pressure, our cholesterol, our weight, our activity level, right? So those are things that we can, our stress level, our sleep, right? So all those are things that we can modify. And remember, those can help to help us manage our diabetes and ultimately manage our heart disease. Good question, though. I like that one. Let's see. How does diabetes affect the heart? How does diabetes affect the heart? And so once again, diabetes affects the heart because the high blood sugar causes damage to the vessels of the heart. That damage is seen by the body, and an inflammatory process begins. That inflammatory process is the process of trying to heal and or fix the damage that the body sees in the vessel. And when it does that, it puts cells there to try to fix them. Those cells cause the lumen of the vessel, or actually the intima, right, the inside of it, to narrow. When it narrows, we get a heart attack. Heart attack can lead to heart failure. Heart failure can lead to arrhythmias. Arrhythmias can lead to death. Right. So that's how diabetes can affect it. And then, oh, look at this. I see. Good day to everyone. Ready with some whole food questions. We're fans of quinoa, lentil, nuts, and high protein sources. I mentioned you earlier. You weren't even here when I talked about you. So this is a blind guy, his wife, their life. Glad that you guys are here. Glad that you guys are here. All right. So let's go ahead. Let's get some more questions here. Not sure what happened to this one. All right. What changes can I make to help reduce the risk for heart disease? And so once again, reducing the risk of heart disease. First of all, let's do the ABCs, right? So A1C, so control blood sugar. B is for blood pressure, control blood pressure, and C, control cholesterol, all right? So those are big ones. And then, of course, the others that we talk about, so obesity, sedentary lifestyle, managing stress, getting good sleep, drinking water, right? So all those are also there. All right. Besides blood pressure and cholesterol, what else? And I think this kind of goes back, once again, to our questions. Or our modifiable things that we have. Let's see. Do I need to try to lose weight, and how much? All right, so this is a good question. I mean, all of them are good, but I love this one. Do I need to try to lose weight if you are overweight and or obese? Let me say that again. If you are overweight and or obese, then yes, you should try to lose weight. If you have some of those other risk factors, yes, you should try to lose weight. And how much? We usually tell people that if they can lose about 10% of their current weight, then that can improve things, right? Now, of course, the more you lose, if you are overweight or obese, the more that you lose, the better it is on everything, right? So your heart, your joints, your kidneys, blood pressure, cholesterol, diabetes, right? So all of those things can improve with weight loss. But we say, hey, let's start by targeting losing about 10% of your weight. Okay. And if you can do that, then we should see things improve. Good question. Love it. Love it. Love it. Let's see. So could medications help protect my heart? Could medications help protect my heart? And the answer is yes. In fact, There are medications that we give to people to protect them from heart disease, right? Some of the newer diabetic medications have been shown to be protective for heart failure, for heart disease, for risk of heart disease. There are older medications that we've used, like cholesterol-lowering medications, beta blockers. All of those have been shown, whether it's primary prevention. So let me use some terminology. So primary prevention means that you have not had a heart attack or an event yet. And so we are trying to prevent that event from happening. That's the primary prevention. And then there are medications that have been shown to be beneficial for people who've already had a heart attack or already had an event. And so they are protective in that case, right? So primary versus those secondary ones. Good question. Let's see. Let's see. So Maria's saying hello to blind guy, his wife. So here is a question. Let's see. Marlene has a question. Hey, Marlene, how are you? First of all, let's welcome you. Welcome. And then let's take a look at this question. It says, so what are the results to diabetics when they keep our ABC under control? Let's see. So what are the results to diabetics when they keep the ABC? Okay. So let's talk a little bit about what that means. So the results are to minimize the likelihood of having a heart issue. Okay. So controlling blood pressure or controlling diabetes, so A, B, blood pressure and cholesterol, right? What we're trying to do is we're trying to decrease the risk of progressing to and or having recurrent issues with the heart. So that's ultimately the goal, right? Because we want to get that A1C below 7. We want to get blood pressure in target for where you are. And I usually tell people, and this is a simple one, and so I'm going to say it, but there are studies out there, there are books, there are people who are specializing in blood pressure and so forth. I usually tell people that I want your blood pressure, right, to be about 120 over 70. Okay. Now, there are studies that have come out that have shown that you can let blood pressures get higher, 140s and so forth. But if we go back and we talk to someone who has no issues with blood pressure, cholesterol, weight, they're not sedentary, right? So 120 over 70, sometimes 120 over 60 is where some of those people are. Okay. Now, the older you get and the more damage that you have, it is more difficult to approximate those numbers, and sometimes approximating those numbers can actually cause more problems, right? So if I get someone and I bring their blood pressure, they use the blood pressures of, 160s, 170s over 80, right? Well, let's not make it that bad. Let's say 150 over 80, right? And I bring that person down to a 120 over 70, right? Sometimes they can feel a little dizzy. They're lightheaded, and so as they're older, we may not want to bring the blood pressure down, and so there are guidelines for those, and you can discuss that with your primary care physician. But good question, Marlene. I like that. Yeah. And so Marlene, she's saying hello, and then blind guy said, Mario, sister Antonia, ha 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 ha. My reputation precedes me, I see. Yes, it does. Yes, it does. All right, so let's see. So Marlene, let's see. Marlene says, so since becoming a diabetic, it seems like I can't lose any weight. It makes me sad. Yeah, so since becoming a diabetic, it seems like I can't lose any weight. It makes me sad. So I'm, let's just attack that one. So in the management of diabetes, there are a couple of things that we want to be aware of. Diabetes is an insulin-resistant issue. And what that means is that in the body, there is a higher level. This is type 2 diabetes, by the way. There's a higher level of insulin in the system. And that higher level of insulin makes it more difficult to lose weight. That higher level of insulin makes you hungry. That higher level of insulin affects other hormones in your body, right? And so as a diabetic, there are some hormones that are also dysregulated. We talked a couple of shows ago about leptin and ghrelin. Remember, that's the hunger hormone and the satiety hormone. So those things are dysregulated. Also, insulin can have an effect on cortisol, which is a steroid, and that can cause problems with weight as well. So Marlene, it is not always a food / lack of exercise issue. A lot of times there is something that's going on that if we don't address it, then it becomes more difficult for us to lose weight, right? So that's one idea. The other idea is that there are stresses that we sometimes don't realize. And those stresses come in the form of poor sleep, increased anxiety, increased depression, sometimes pain, right? So all of those things have an effect on our management, not of just of blood sugars, but also of weight. And then finally, not finally, but thirdly, we have medications. So sometimes the very medications that we use to manage diabetes themselves can cause it to be more challenging to lose weight. So Marlene, don't give up. So I said a bunch of things, but that's what I want you to get. Don't give up, okay? Because it is so important that you continue trying, talking with your healthcare provider. Maybe see a nutritionist, maybe get a coach, right? So all those things are things that you can do, but don't give up. Very good. But thank you, and I feel that, Marlene. And so she's saying hello. Mary Blind Guy did wise. We always want to see your name on Mondays. I love to read your takeaways. All right. And so Carolyn says, when should a person with diabetes start some kind of cardiac screening? I love that question. And let's see, can I get that off there? So Caroline, someone with diabetes should, if it's a person with type 2 diabetes, right? I usually recommend that those people, as part of their initial screening, as they get into the management of their diabetes, that we get them connected with a cardiologist. So some of the things that we do, right, for someone who's diabetic, and we did a show back in December, maybe November. I'll find that and put a link to it. But we talked about some of the things that we do in the management of diabetes. So we get people connected with the ophthalmologist for their eyes. We get them to do a foot exam. We're checking their cholesterol, their kidneys. We're checking their thyroid, their microalbumin, right? So all of those things are things that we're doing. And we also recommend that they get connected with cardiologists, particularly depending on their BMI or their weight status. Okay. For our type 1s, not so much that quickly, but certainly someone who is obese and or overweight. Because remember what we're about to do. What are we about to do? We're about to get them exercising. Okay. So someone who's been sedentary, who has high blood pressure, high blood sugars, who hasn't moved in this way for a while, right? We're about to get them moving, and so I like to get them connected with a cardiologist. Good question. Hello, Caroline. Marlene says, yes, sir, I will keep trying. And G. Albert, hey, man, what you doing? How's it going? It says, my wife and I are tracking our glucose and blood pressure daily. Weight is at a steady level. Okay. All right. Now, is that steady in the direction we want? Steady right? So yes, so we want to make sure that you do that. I have, and one of these days we'll we've got some software that I'm using. My wife has a journal that she uses in her coaching program, and I've adopted that to my electronic device. So I've basically recreated it, and every morning that's what I use, right? That journal, to be able to set the tone for my day. What am I going to do? One of the questions in there, which sometimes I don't have an answer to, it says, do you have a plan? Let me see. It says, do you have a plan for your food today? Yeah, buddy. Do you have a plan for your food today? Okay. So very good. Very good. Thank you. Thank you, G. Albert. And then let's see. Blind guy, his wife, their lives. When you say poor sleep impacts diabetes, do you mean not enough sleep, REM sleep, waking up for restroom breaks? What is it? My husband's question. What's up, Corey? How you doing, man? Good to see you guys. Good to see you guys here. So poor sleep. So our body regenerates during sleep. And we should get about 7 hours or more of sleep per night. And when we are sleeping, the body integrates all the crazy stuff that went on that day, right? It helps to repair our cells while we're sleeping. And if we are getting enough sleep, and we're getting those REM sleep, those deep sleeps, our cortisol levels begin to drop. And for guys, right, remember that's where testosterone is coming, right? That's what testosterone is doing. And testosterone levels, as those rise, can also cause better stress management and so forth. So when we're talking about sleep, we're talking both about length and quality, right? So both length and quality. And if we're getting up multiple times during the night to urinate, then that's causing fractured sleep. And fractured sleep does not do well as we're managing all these integrated or all these interconnected issues that we may have. Okay. All right. So let's see. Oh, Naveen. Naveen said, hello, I am from India. What's going on? Naveen, welcome, man. Welcome. He said this in the morning. He said, ooh, Gandu. Okay. So welcome to our community. All right. So let's go back and let's see if we can grab a couple more questions. Let's see this one. How often should my heart health be checked? What tests would you recommend? Very good question. And the heart tests that they typically do, EKGs, right? They do CT angiograms. They also do stress tests, right? So those are the big ones. And those are depending on what symptoms people are having. It depends on what their previous evaluation was, right? So when I went to my cardiologist, we actually started out, we did a EKG, we did an echo, we didn't actually do a stress test. We actually, went beyond that. We went directly to a cath because I was having some issues, right? So depending on where you are, your evaluation may be different, and then your cardiologist will set a time. If there are acute things going on, then a lot of times they'll see you every couple of months, every 6 months. But if everything is good, then it's just, hey, come back in a year. Okay. So those are the things. All right. And then let's see. Thought of the day. Recently, we did actually not recently, but yesterday, last night, we did a vision board party. So vision board building party with our team. And it was a fascinating thing that we did, guys. So we were on Zoom, and our team members were at different places, and we went about constructing our vision boards. And you guys may remember that my vision board, I don't know if you can see right here, right? So this is the new one that I started constructing last night. All right. So the old one, you may remember. Let me see if I can grab it real quick. All right. So this was my old one. Okay. Oh, there you go. All right. So this is my old one. All right. And so we are constructing the new one right now. So we're continuing to work on that. But one of the things that came out of this was one of our team members was talking about changing the mind. And we've mentioned this before, changing the mind. How do we change the mind? Because if we can change the mind, it changes how we respond to a thing, right? Because remember, something happens, our thought about that thing dictates how we feel about it. How we feel about it dictates what we do in terms of action, and the action dictates what our result is. Okay, so that's the train. And so we were talking about changing the mind. And then this morning, I was listening to a guy that I follow, RK3. If you have not done so, go ahead and check him out. Very good guy. He does a show in the morning on Mondays. It's called Mondays Get Up and Go. So he was talking this morning about the imagination, right? And being able to imagine something, right? Which goes right along with what my team member was talking about in terms of changing the mind. And so I got to thinking, you can only imagine as you educate your thoughts, right? So if all you're seeing is your little box, then the imagination really is kind of stifled. So being able to integrate, being able to travel, being able to read different things, interact with different people, being able to begin to expand, right? So educating your thoughts is where the power comes, right? So the stuff that you put in, you remember one of the videos that he sent us says garbage in, garbage out. You remember that with computers? Yeah, whatever you put in is what you get out. And if you don't put anything in, guess what? There's nothing coming out. So begin a systematic way of informing your thoughts by experiencing things, traveling, interacting with people of varied walks of life, reading, right? Putting things in the mind so that your imagination has things to grab onto. And the imagination has things that it can use to help you soar into whatever it is that you are doing. Guys, as always, I really, really appreciate you guys coming by. Thank you for being here. Thank you for coming by and spending some time with us on this channel. We love your questions. If you've not already done so, once again, go ahead and subscribe, send to your family and friends, let them know what we're doing here as we grow this community. Let's see, let me see if I can grab, do we have any last minute questions? Okay, so Maria said we saw that one again. When should a person, hello, Caroline. Yes, sir, I keep trying. And Naveen, welcome. Glad to see people watching from India. Yes, right. We're glad to see that you are watching from India. So GL says feet tingle, but PCP is not worried. He's tracking my A1C and floaters in my eyes. Oh yeah, yes, GL, very, very good. I'm glad that they are. I'm glad that they're keeping an eye on all those things. And then. Carolyn says, for your information, I called your office today and your staff was awesome. I also get a person right away, which is so appreciated. Thank you, Caroline, or Carolyn, sorry, for saying that. We really appreciate it. So guys, this is it, right? So we will see you next week right here at 7 o'clock. This is Dr. Dwain Woode from Diabetes and Endocrine Wellness Center and The Light Away. We encourage, we educate, and we empower you to take charge of your health, avoid complications, and live a healthy, fulfilling life. Let's get on out of here. Let's see.